All right, welcome to Beyond the Bones podcast. I'm orthopedic surgeon Peter DeNoble, and I am your host. And I have an amazing guest today, Dr. Rob Coninello, who is a great man. I'm honored that I can call him a friend, but also, I wanted to bring you on to help share a lot of the knowledge that you have with a wider audience. Even though you have a huge audience, but just even spread it a little further, and give you the opportunity to talk a little bit about some of the stuff that you're into clinically, some of your life experiences, and so I just wanted to say thank you for coming on and welcome.
It's cool to be here, and like you, right back at you. It's good to have a friend like you. My little brother, who I could ask important questions to, and make me look cool sometimes. And I totally appreciate everything that you bring to the table. So thank you for letting me be here in this forum to tell my story.
Cool. So I met you first of all, and I did a little impromptu testimonial a few years ago on the ski slope when I was snowboarding because I had Achilles tendonitis for many, many years. And I actually saw an orthopedic surgeon up in Rhode Island who I thought I was going to need surgery for sure. And it turned out that I didn't. And the reason why is there were some other options. There were some non-operative options. One of them was the shockwave treatments. You mentioned PRP as well, which I didn't have. But so I pursued, at the time, it was radial shockwave. It wasn't with you.
That's right.
And I had done a couple of different times through the years. I had done radial shockwave, and we can get into the particulars of what that means and what shockwave means. There's actually there's some significant nuance to that.
Absolutely.
And so I ended up having that, and ultimately when I met you, I had some, I guess we'll call it recurrence. What it really was I think I developed like mid-substance or something, and then you had some more advanced shockwave options, and we can talk about what those are, and I'll shut up, and then you just.
Yeah, it's like you came with a problem that I see a lot in my practice, and the way I always look at every patient that comes in, it's the problem is not the problem. How you deal with the problem is the problem, and I think that most docs always go down the rabbit hole of saying, well, this is what we have, this is what we do, and not look at it from different points of view. So I always want to figure out, like, not just what the what is, it's Achilles tendon, but why do you have it? So I think at the time, we also talked about, like, all right, what are your goals? What do you want to do? What are your strategies? And, you're an active guy, you're a father, you're a physician, you're a surgeon, you're a podcaster, and all the above. But your goals were to keep busy and to do more, and you couldn't have this slowing you down. You wanted to be on the slopes and do your things as well. So I thought the best strategy for you was to figure out what you had, and I don't think you really had Achilles tendonitis. I think you had more of a scarring. You had tendinosis. You had this
Right.
not an inflammatory process, but a degenerative process. And how could we get this better? And we could have tried doing things like physical therapy, but you had tried doing some of those things yourself, and it really wasn't getting you there. So, we said, all right, here's the problem. How can we get it better? And at our hands, we had something called shockwave therapy. And shockwave therapy was something that was able to increase your vascularity, increase your circulation by causing a little bit of an insult to that area. And once we caused that insult, your body started to kick in, and you were able to get regenerative changes to that tissue and go back from that scar, that tendinosis, back to normal tissue.
So and just so, what's the course of treatments? So I mean, I kind of know now, having done it a few times, but what is the treatment? What does shockwave treatments look like? Is it invasive? Is it how many times you have to go? How quickly will you recover?
Yeah, and that's the art of it too. I mean, there's science behind it, and the art is how each individual does it. Having the opportunity of doing this now for, close to 15 years, I've seen how it's progressed over the years. And the way I do it currently is if a patient comes in, and we use a combination of both what's called radial shock wave, which is kind of like a pressure wave which is a propulsive wave where we kind of able to go over a larger area. So we go along the tendon, we go down to where it inserts as well. We go to the muscle belly around it and try to increase blood flow using this radial shock wave. I always think of that as kind of like if you drop in a rock into a pond, you kind of see the ripples. That's what we're trying to do. And that almost gives a little bit of like an anesthetic effect. And then we use something called focal shock wave. Focal shock wave is that laser beam that goes right to the spot that hurts the most. And once we do that, we really get down to that bone-tendon interface, and that really starts to bring more blood flow and circulation to that area. And currently now we're doing something called EMTT, which is electromagnetic transduction therapy, which is using magnetic therapy. And when I first heard about magnetic therapy, I thought it was like a hoax, to be quite honest, because back in the 90s, we all heard about magnets, people wearing bracelets and stuff like that. And does that really mean anything? But nowadays these magnets are so strong, they're measured in Tesla, and the ones that we use are 6 millitesla. And what it does is like all this shockwave stuff we're doing, we're bringing like good things to the party, like circulation and stem cells. And then what the magnet does, it kind of opens the doorway. So it allows the cell membranes to allow these stem cells to come in.
So it's sort of hitting it from different angles with different regenerative options or different regenerative modalities to give sort of an additive regenerative effect, which ultimately just stimulates your body to heal an area that it kind of gave up on.
Yeah, exactly it. And that's where sometimes things that we've done in the past, using ice, using anti-inflammatories, maybe even using things like injections of steroid, which we really shouldn't be doing, but has been done in the past, really doesn't work because it's not inflammatory at all. It's degenerative.
Well, that's actually one of the things that I see in my office. Sometimes I don't, treat Achilles tendonitis. I refer them to you. Every so often someone will rupture their Achilles. I've fixed those, certainly more in the past, but every so often I'll hear people tell me just kind of in passing, I had a steroid injection in my Achilles, and it makes me like shiver inside. I don't want to like say anything, but really, I learned this as a resident that you're not supposed to do because what happens? They rupture.
They do rupture. It's a poorly vascular area to begin with.
Right.
And so now we're decreasing the healing rates in those areas. So it's just not a good idea to inject those.
What's so interesting about steroids is that they're so effective in a lot of ways, but the downside of what steroids do to tissues is really coming into focus on the long arc of research, meaning like I'd say in the last several years, even more so, they're coming up on our board exams now, where we're really seeing how detrimental cortisone is, as ubiquitous and as covered as it is by insurance companies. And, it's been around forever. It is very useful in certain pathologies. But in other pathologies, when used kind of indiscriminately or more just kind of willy-nilly, it can really have a pretty negative effect. And so certainly the Achilles is a good example of that. I think of it from like the perspective of like a rotator cuff or a tennis elbow, which, I probably a lot of surgeons are still doing that. But the more you look at the research, the more you look at the long-term effects in populations of patients that have either rotator cuff tendonitis or like lateral epicondylitis, you realize if they get surgery too quickly, they can have a higher risk of infections, and B, they may not get better. So it's probably similar in other, like the foot and ankle.
Absolutely, and we can't look at patients in a bubble either, right? So some of these patients are coming to us might also have other issues, might have endocrine problems like diabetes. And now we're changing that whole way that they act because now their sugars are going higher and causing other problems too. Right. So I think that's like very reactive medicine.
Right.
I like to work on a little bit more proactive medicine and how can we get these individuals to help themselves get better.
Yeah, I think that the next phase of musculoskeletal care, it'll be probably a fine tuning of the tools we have now, and probably there'll be new tools, there'll be new ways that we can kind of regenerate new as opposed to like kind of heal old.
Yeah.
And we're kind of in that weird space where like there's a lot of heterogeneity, or there's like a lot of the studies, the research on there is like mixed because, what we call PRP or what we call shockwave, well, it might be focal shockwave, or maybe they're just doing radial and they're saying, well, shockwave doesn't work.
Right.
but or PRP is not not effective. But when you look at the actual details of the research or the methods, you realize they're either using a radial machine, or maybe they're only doing one treatment. Right. That's why you need to have these machines in the hands of experts.
Yeah, and people like myself who maybe made mistakes, along the way. I've had, like I said, 15 years of experience using it. Our protocol now is usually to do 6 treatments over 6 weeks.
For what? For which conditions?
For most tendinopathies that we see, and why 6? Because 4 was better than 3 and 5 was better than 4, and we just seem like it's one of those situations where more is more. The problem with a lot of these therapies is that they're not covered by most people's insurance plans.
Right.
So that's where the situation is that
even regular problems aren't covered by your insurance plan. So at that point, wouldn't you rather pay, even if it's just paying the doctor for the problem directly? You're going to be paying sometimes $500, $1,000 or more for a deductible anyway, plus a copay just to get an opinion and maybe to get a cortisone injection. Wouldn't it be better just to? So what's the big deal? Fortunately, the cost isn't crazy high, right?
It's not crazy high, but it goes back to what you said before. You want to get in the hands of people who have experience, know what they're doing, because there's a lot of people out there who are using it for the wrong reason, just for economic benefit. And you want to make sure that whoever's doing it knows the best protocol to get these people better the quickest way. Yeah. And heck, if I could get a patient better in 1 or 2 or 3 treatments, I'd be really happy. Unfortunately, it doesn't really work that way.
Right.
But if we could try our best to get people better quicker, why not?
Do you use PRP or?
So I do use PRP, but I use more biologics now, to be quite honest, in my practice, because I find in the foot and ankle complex, the PRP in my hands doesn't work as well as the biologics. I'm not saying that. It works better. Biologics work better than PRP. I'm not saying that it's not a good thing to do, but for me, it just doesn't seem to be as beneficial. There's been some studies that show even that comparing PRP to just needling, that maybe there's not much of a difference. However, the biologics seem to be a lot better. For me, the biologics I find lay down this kind of like matrix or this internal skeleton that kind of helps keep that area more structurally sound while we're giving that, and then we can use the other things as well.
When you say biologics, what are you talking about?
We use things like umbilical cord tissue that's been freeze-dried that we kind of rehydrate, and we inject that into it. Yep.
Now, and I know that was a topic, that the FDA has kind of gotten involved a little bit with some of that stuff, looking at, is it experimental and where the studies were. So I know there's some issues currently regarding that, but right. Is it still sort of, as far as like?
It's getting better. I think it was fine, and it wasn't fine. Now it's getting fine again. You know, so they're kind of flip-flopping back and forth. And that is where the art comes involved too, and as a physician, you have to believe in it, and you have to believe that it's going to make a difference. I remember that one time I heard someone say, like, when you go to hear a preacher speak, you don't have to leave there believing in God, but you better believe that he believes in God. Right. So I kind of feel the same way, that I have to believe in what I'm doing is going to help an individual.
Well, that's interesting. So you bring that up, and that gets into a whole nother topic, which is the placebo effect, right? Because our minds are so powerful. We live in a physical world. We feel like, everything, is what we see and what we, diagnose will have this, course and outcome. But what governs, I believe, and I'm learning, the more I learn about the power of the mind, the more I see in practice and just in other stories and other things that I read. And it's like, it's so powerful because, and I mentioned the placebo effect, because the placebo effect is where you believe that this sugar pill that you took will have the intended effect of, the actual drug.
Yep.
And when you see studies that are placebo controlled, where one group gets the sugar pill and one group gets the drug, the sugar pill group oftentimes gets better. The SSRIs and antidepressants are a great example of that. And what better of a realm of evaluation is it than sort of a disease of the mind, the depression, right?
Sure.
That believing that you take something that's going to make your mind better, your mind makes then better.
Yeah, that makes sense.
If you look at those who got sugar pill versus those who got SSRIs, there's a very marginal difference between those who got the actual medication. But we don't prescribe sugar pills, and then we wouldn't believe in it. So
Right.
there's a whole complex of them believing in us believing in the treatment then being administered and taken. And so, and you even seen some of these studies about, you can look at the methods and question them, but, with sham surgeries, where people get, I think they've done some studies with like knees, remember the kyphoplasty literature and spine, where they were just doing sham surgeries. I don't even know how they got that thing, those things approved, but they did it, and these people got better. And it was like, wow.
Yeah.
What is that?
Listen, I'm a science-based guy, so I definitely believe in evidence-based medicine. However, I do believe that there's nothing wrong with a placebo effect. If it works, why not?
Right.
Nothing wrong with it, if a patient's feeling better. But there has to be a combination. And I think it's more about the doctor, the physician, the surgeon taking time to develop a relationship. So relationships are based upon communication and based on trust. So I think, unfortunately, many of us, especially the younger docs, are missing that piece. They're not taught that. And maybe we don't learn that until maybe we've had our own personal experiences, and we can go forward and learn from that as well. But I think that, I personally have had that myself, and I think I've become a better physician and clinician.
But yeah, and that's a good point. Like that's a good segue into some of your own life challenges, because you've spoken about this very publicly and have been really, I think, probably a really big inspiration for a lot of people, certainly myself. But I'll let you tell your story. But why don't you just go ahead and tell us about your challenges with your...
Yeah, so, it's probably about 8-9 years ago now. I was working in my practice trying to just do my thing, and I started getting pain in my head and in my ear and in my throat, and I just thought nothing of it. I was an athletic guy. I was doing okay, but it was getting worse, and it kind of was becoming to a point where I was feeling as though I was getting intense pain in my side of my head and my ear, and it would be like once a week. Then it became once a day, and then it was becoming really common, almost hourly. And I was trying to deal with patients, and I just couldn't go on. I was having a tough time. And to the point of where I would like see a patient and then go back into my office and just put my face in my hands. And sometimes, I would get emotional, because I was like, I don't know if I can keep doing this. And that's not me. I'm a pretty happy-go-lucky, bit of a knucklehead at times, and for this to be bringing me down and making me blue, I didn't want that to be that way. So I started my quest to find out what was going on, and I went to the medical doctors, and I went to the ENTs, and they kept saying it was nothing or maybe inflammation. One primary care doctor looked at my ear and he said, I think you have a pimple in your ear. And I'm like, well, I have a pimple in my ear. That's what's bringing me down. Come on, man. I think I'm a little tougher than that. But, we kept looking forward. And I remember at one point in time, my wife, she called me from her car. And she's not a physician. She's an attorney, so she's a fact finder. And she said, I think I know what you have. I think you might have this condition called glossopharyngeal neuralgia. I didn't know what that was. I knew what the glossopharyngeal nerve was, ninth cranial nerve, for those people who don't remember.
I didn't remember.
Yeah. But so I said, yeah, maybe it is that. So we went to one of the hospitals in New York City, and we went to the chief of their department, and he was really quite good and thorough, and he couldn't really figure out what was wrong with me. And he said, it could be some of these zebras that are out there, and one of them could be this thing called glossopharyngeal neuralgia. We didn't say anything. We didn't bring it to him. It was just like, thank you. And he actually said, I'll be quite honest with you, I don't know how to deal with that, and I don't know many people who do know how to deal with that. And I was like, okay, thanks. So like we left that that day, we went down to the parking lot, and my wife goes, we have to do now. Now we have to find the person who does understand that.
Yeah.
So we wound up going to and finding that the University of Pittsburgh they were leaders of dealing with this problem. It's kind of like a similar problem. People have trigeminal neuralgia. Glossopharyngeal neuralgia is one that affects your swallowing and things like that. So we called up the doctor who had done the most amount of papers on it, and I actually got his medical assistant and said, hey, it was Dr. Janetta, Peter Janetta, at the University of Pittsburgh. He's like, he's in his 70s now. He's not really doing so much surgery anymore. But, we do have this doc who we trained. He's in New Jersey, and he's excellent. So we looked him up, and sure enough, he had done a lot of papers on it too. So we went down to visit him, and we saw him, and he gave me another very thorough exam, and he showed me the differences from one side to the other, and I saw that there was this problem with my nerve, and it was wrapped around it was a vessel wrapped around my nerve coming from your brainstem. So he said, look, you could try to do this conservatively with medications and things like that. He gave me that option. I said, Doc, I want to get this fixed. I want to fix the why. We said before, not the what. And he said, okay. So he said the surgery is not easy, and this is what you have to do. So we did this open brain surgery, and he kind of decompressed that nerve, and it was a tough kind of recovery after that.
So wait, hold on a minute. So you had brain surgery.
Yeah.
Where do they go in? How do they go after
so I have an incision on the back of my head right here.
Wow.
That's pretty significant. They went in that area, and it was a long procedure, as you can imagine. And needed someone who was really quite qualified at it, and he was great. He was terrific. He was the right guy to go to. And he did my procedure, and then I had to recover, and I definitely felt better. I probably said, if I was having 10 out of 10 symptoms beforehand, I was probably down to 5. So that was a huge change, because those 10 out of 10 days were days where you felt like hope was lost.
Wow.
And you get to that kind of dark area, and you're having chronic pain like that. That's intense. That could be tough. So I was pretty happy that I was doing much better, and I kind of went on my way. And after about a year, I started noticing that symptoms were coming back, and I was like, man, I didn't want to go through and tell anyone again, And so I kind of tried to just get through it, but it wasn't doing well. And I had actually become quite friendly with the surgeon. We were very similar, and we're still friends to this day, as a matter of fact. We were same age. We were both, had the same kind of family values, and kids and sports. He was a wrestler. He's a really good wrestler, not like me, but he's a really good wrestler. Anyway, he said, hey, you know what? Maybe I'm too close to the situation. We kind of crossed that doctor-patient relationship, which I'm sure you've done in the past too, like I've done with you. You came to me as a patient once, and now we became friends. And he was, smart enough to say, hey, maybe you need to see someone else and see. So he referred me to one of his friends in Manhattan, and saw him, and he's like, man, everything seems pretty good. I don't know what's going on here. Maybe you just need another exploratory surgery. And I was like, oh, man, I really don't want to do that.
What kind of exploratory surgery?
Well, maybe to go in there and do the same procedure again.
Like the same brainstem?
Yeah. I'm like, oh, man.
Okay.
So I really wasn't happy about that. And he said, I'm going to send you to one more doc. He's a pain management guy. I want to make sure we're not missing anything. So he was this older guy. Go to see him. And he really didn't have a lot of time for me, to be quite honest. And he's like, yeah, it seems fine. Either take medication or get to surgery. I was like, all right. He said, hey. And he was like, I remember reaching for the door, and it was like a seminal moment for me. And I said, just, will you listen to me for a second? Here I'm a patient. I'm a physician too. I said, I know I'm not the smartest guy in the world, like you, but when I stick out my tongue, it's going the wrong way. I don't think that's right? And he's like, let me look at that. I kept telling him, but they really weren't listening. There again, there's like that relationship that doctors need to have, right? They have to be able to build that trust.
Right.
He's like, all right, I'm going to send you for another exam, so another MRI. And he calls me up that night, and he goes, yeah, it seems totally fine. Whatever they did, you're okay. I'm like, I said, but my throat. He goes, I'll send you for another MRI. He got actually angry at me. He said, I'll send you for an MRI lower of your throat. I'm like, okay. So he I went and did that. He calls me the next day, and he had a different tone. And he said, hey, you have a really large mass in your throat, and you need to find the best surgeon possible and quickly.
You have to find them. He was going to help you that.
I was like, wow.
Wow, that's crazy.
Yeah. So once again, my wife and I are trying to find out the best possible place. We went to another facility.
Oh, my God.
And we go to this other facility, and they examined me. And this was, I went to this doc, and this doc was like, I always say, the rock star doc. He had done surgery on a lot of really important people and athletic people and rock stars and movie stars. And he was a surgeon, and, surgeons have sometimes, they're kind of focused on what it is, right, the surgery. And I remember they did this biopsy of me right there in a chair, and it was like literally, I'm not exaggerating, probably about 8 different residents and fellows following behind them. And so the individual who actually was looking in the microscope was right next to us, and all the residents and all the doc left he just left my wife and I with this gentleman, and he's looking in his microscope, and he goes, "Oh, this is really bad."
Wait, hold on. So they did like a needle biopsy?
A needle biopsy.
Okay, so could you feel the mass?
No.
So it was something you couldn't see or feel. You could only see it on the MRI.
Yeah.
You're in this guy's office. He somehow, did he use ultrasound guided, or
No.
just kind of by
Just like
knowing
looking
with the
in it
anatomy?
and,
Okay. And so they stuck a needle and they peppered it, or they aspirated some stuff. They shot some cells onto a slide right in front of you.
Right in front of us. No
Not even
anesthesia.
just step outside the room. It was inside the room.
Like right next to you, right there.
So you were part of the fellow team, essentially, but as the patient.
And he's looking at it, he goes, "Oh, this is really bad." I was like, I hit my wife. I'm like, "Are we
Just
imagining this?" I'm like, "Hey, man, I'm here."
Yeah, I'm right here.
And he goes, "Oh, excuse me." He goes out, has a conversation with the doc and the team, and they come back in. And I remember it was like out of a movie, because I'm sitting there, my wife's next to me, the doc is sitting backwards, the chair backwards, and in front of him, and his team is behind him, and he starts saying, "Hey, this is not good. You have what's called adenocystic carcinoma," and he said, "This is something that is not is you have like a 20% survival rate, and you have stage 4 at this time." I was like, "Oh my God." This is what they're telling me right now. And I was, obviously rattled, right? I didn't expect that. I went from having an ear pimple a few months ago to all of a sudden having, this sentence after having surgery.
Wow.
So I remember at the time, for some reason I was focusing on this one resident, and he was like this kind of big, strong, buff guy. And he was right behind him. He looked really serious. And I remember saying to him, I had, kids that were probably about, 10, 11 and 12, and I said, "Can I just still have a catch and play ball with my kids?" And 'cause that's all I really want to do. Just let me know I could still do that. And I look up at that buff resident, and he had tears coming down his face. So I'm like, "Man, this is real. This is real." So he said, "We're going to try our best," and he went off. So he said, "Listen, we're going to schedule a surgery for you, and here's the plan. The plan is that we're going to remove your jaw. We're going to remove 90% of your tongue. We'll try to rebuild your tongue from your forearm." I didn't know that could be possible. And then we're going to give you a tracheotomy. And life is going to be different. And then after that, we're going to try to give you radiation and chemo. And still, like he said, 20% survival rate.
After all that, you get 20%.
Yeah, so it was daunting, as you can imagine. So, since I had kids, I would always tell my kids, my motto was, do great things, right? So they would say, "What does do great things mean?" I said, "Do great things mean whatever you do in life, if it's your academics, your sports, being nice to others, just be great. Just do whatever, people remember you." So I remember I came home that day, and I sat down on the floor with my family, and I told them this, here's what's going on. I didn't tell them exactly what's going on, but the dad's going to look a little different, and we're going to struggle a little bit here, but we'll do our best. And I remember my one son stood up and just put his hand on my shoulder and said, "Time for you to do great things." So it was like that moment. It was like that from Rocky when Adrian
right.
says "win," you know.
Yeah, yeah.
So I'm like, all right, this is my job. My job is to do this. So it was right at Thanksgiving time. So we had our Thanksgiving meal, and then it was the Tuesday after I had to go in for the surgery. And the Monday before the surgery, the surgeon calls me back. And this is this rock star surgeon. He goes, "I was just checking in on me." He said, "Hey, we might have gotten it wrong." I was like, "Excuse me?" He goes, "Yeah, I want you to come back in for another biopsy under anesthesia."
Yeah.
Okay.
Like an open biopsy this time. Because usually, like, the diagnostic accuracy on a needle biopsy is much lower than a actual tissue biopsy. Like, you never want to, like, hang your hat and remove someone's jaw and be like, whoops, sorry, you know. Like,
Yeah. So we went in there, we did it, and he came back after he did this biopsy, and it was a really quick, recovery room visit, and he said, "Hey, it's not adenocystic carcinoma, it's squamous cell carcinoma. It's still bad. It's still like at stage 4. You still got to go through a lot of stuff, but you probably could do it with chemo and radiation." Like, all right.
So it's like good news. You have stage 4 squamous cell.
Yeah.
Like, you don't usually hear that, but
I'll take
for
it,
you,
right?
yeah, absolutely.
So now we went to and we did that. So I had 55 treatments of radiation in 55 days, and chemo at the same time. So it definitely beat you up, and I got really sick and was hospitalized for a period of time because I got really weak. I lost 50 pounds in 3 months. I really couldn't eat and do much of anything, but we got through it, and it was a weird thing. As I was going through that, the surgeon who did my brain surgery kept calling me up, like once a week, checking in on me. "How are you?" And he was being friendly. He's trying to be nice, And I'm like, I'm doing not great, I'm not really doing great, but I'm trying to do the best I can. And so we got through it, and it shrunk the tumor. And knock wood, I'm still here. And I went back to work, and I did all right. And then the story just keeps getting crazier, right? So I remember like a year later, the brain surgeon called me up, and he said, "Hey, can I take you to dinner?" And I'm like, "Oh, what? My brain surgeon wants to take me to dinner?" I'm like, "Yeah, sure." So we met for dinner, and he goes, "I just want to see how you're doing." I'm like, "Oh, I'm doing all right." He goes, "Hey, I want to let you know I'm writing a book too. And I want to put your story in my book. My book's going to be about dealing with fear. Surgeons have fear, and this is a brain surgeon's quest to outthink fear." And I'm like, "Sure." So I want to tell your story, and if I want to ask you one other thing. I'm like, "What?" He goes, "I want to beg for your forgiveness." I'm like, "Why?" He goes, "Because I did unneeded brain surgery on you, and I'm sorry." And that was I remember saying to him, "Wow, that's quite heavy over appetizers." Didn't see that coming, but I said to him, I don't know where I got the grace to say this at the time. I said, "What'd you learn from it?" And he said, "I learned that I have to think, when I hear a horse's hooves, you have to look for zebras too, not just hooves, not just horses. So you have to think about the things that it possibly could also be."
That's interesting too, because although you were sent to him from an expert but the problem is that when you start to get into those sort of coned in, hyper specialized doctors, like you mentioned, sometimes they start seeing things that, and they're blinded to a wider differential, because that's just not, a lot of times they're being referred these cases by others.
Right.
That's very interesting. And so, but you got better though, at least moderately so after the surgery.
Yeah, absolutely. And, I give him credit for having humility to tell me that and to be brave enough. And I think he needed it. He told me that he needed it. So he wrote his book, and his book became a really, really good seller. And I'm a chapter in the book. And I remember at the time he had said to me, "I won't put your name in it. I won't put your occupation in it." And I remember saying to him, "Hey, do me a favor, put my name and my occupation in there, because I want you to read it every once in a while and realize that I'm not a character in a book. That it really did happen, and you know me." And he said, "That's fair." And to this day, we're still friends. But the best part of the story was that he did call me about 2 months later. I was seeing patients in my clinic, and he said, "Hey, I just want to let you know, I just saw a patient had your exact symptoms, and we thought it was glossopharyngeal neuralgia, and we sent him for tests, and it wound up that he has throat cancer, but stage 1." And I'm like, awesome. I said, we just helped a person, a family, and loved ones that love him. So, like, I think we do have this ability as individuals, as physicians, as just people to, we have the gift of influence. We can help each other out if we just think about others. So, like, my whole idea now is life is about others, and we got to do great things, and that's my story. The other part of my story was, like, when I was going through this whole thing, I'm a solo practitioner, so I thought that, man, my career's over. How am I going to keep working and all this? And unknown to me, there was a group of doctors who decided to come into my practice and work for me, and didn't even tell me, and they were just seeing my patients and keeping the lights on.
Wow.
And they were helping. So they were gift of influence. They were influencing me and helping my family and the people who work for me.
And your staff and the business, because you're a small business owner, right?
Yeah,
at that point, so you're single-handedly normally supporting a bunch of people in their jobs. So that's really a wonderful, testament to you that you inspired others to help you at the time, as opposed to just sort of saying, he's out, one less, competitor, which, I feel like sadly a lot of times we see each other as in this healthcare world that we're living in.
It's true. And like we started this whole conversation about, like, Achilles tendon problems, right? And we get into this heavy part, but I mean, I see every patient, I want to advocate for them. I think I always did to a certain amount, but even more so now. When someone comes to me and they're in pain, I never belittle it.
Mm-hmm.
I want to hear them out. I want to help them. I want to help them figure out the root cause.
You have to.
Yeah.
I mean, it's so important. And even when we think, I'm just tired, but you're thinking from your own perspective, right at that point, and that's dangerous, because then you're not thinking about how can I help this person, and that's where you either need to end the day, right, or just reset your approach. I mean, I've had to do it myself, never ended the day, but had to reset my approach when at times you get carried away or feel like, oh my God, these complaints.
Yeah.
But people have, everyone has pain and problems. That's what they're coming to see us for. So you have to always, reset and, so.
Yeah, I think as physicians too, we have to always remain humble and realize that we may not at that moment always know the answers.
Yeah.
So use all of our resources.
Correct. Right.
Use people who maybe have different experiences than you. So to me, that's a really important lesson that I learned as well.
Yeah, it's really a moving, that story is just so inspirational to me, and I just think that facing that sort of, even just the first part, even though it wasn't adenocystic carcinoma, even though it wasn't that, just even having that window of a couple weeks, 3 weeks or whatever, of sitting around, with that idea, that can really weigh on you. It probably puts a lot of your life in perspective pretty quickly.
Absolutely. And I still haven't learned enough lessons. I remember at one time the doctors say, I hope you take more time for yourself to do the things that you love. And sometimes you get caught up.
Yeah.
And I need to learn how to do that better.
We all do.
So I'm working on that.
We all do. And we're in a very kind of, I won't say odd, but very kind of materialistic society where you have to keep working to live in this world, especially in our society. It's not a village where we can just hang out and live our best life, go to work and relax. And I feel like we're a lot of us are on treadmills, and
no doubt.
You try to balance it out, but you're still running
Right.
no matter what. But you've done a great job with all your kids. And one thing that I wanted to touch on as a lighter topic was your love of scooters.
Yeah.
You told me this story when you visited your son out in California. And I only bring this up because you've got some amazing stories. Every time you have a story, it never fails to impress me. But you were telling me, I won't tell the story for you, but why don't you go ahead and if you wouldn't mind sharing your experience. It's just like simply like, crossing, like barely surviving by the skin of your teeth. Your son, I think it was.
Yeah. So like this.
Oh my God.
Well, I love the quote. Dr. Gilbert, he's a sports psychologist I listen to, and he always says stories are told in the present about the past, and hopefully you remember them in the future.
Oh my
So whatever story you tell, hopefully you remember the point of it. So I went to visit my son out in California. He goes to the University of Southern California, USC, and we were there last summer. And we were going to go to a Dodger game, and we took a cab to the Dodger game, an Uber, and there was, I don't know if you've ever been there, but there's one spot where there's just lots of traffic, and he said, why don't we hop out and we walk the rest of the way? It's like, another mile or so. I'm like, yeah, let's do it. And then he said, hey, there's 2 scooters, you can hop on. You want to get on the scooters?
These are like those rental scooters.
Yeah, it's like an app. Okay. You kind of get on it and you go do your thing. And he said, I remember saying to me, he said, be careful, old man, this is, don't get hurt. And I was like.
Your son said that to you?
My son said that to me.
There you go.
I'm like, right. Thanks.
Don't get hurt.
Thanks,
Dad.
buddy. I'm like, okay, I'll follow you. So he gets on the scooter, sets me up, gets me on the scooter. And he goes, all right, come this way. We're on the sidewalk, so he kind of merges on to the street. And I'm probably about like 50 yards behind him. And he merges onto the street. And as soon as he does that, a bus merges towards him, and they collide. And
hit by a bus.
I hear bam. I see literally a cloud of dust. I don't see my kid, and I hear crunch, and I hear women screaming.
Oh my God.
It was like that. We were going to a Dodger game, we're having fun, get on the scooter, and then boom, gets hit by a bus. Cloud clears. The thing is run over by the bus, and my son is on the side. He's okay. He's startled. He's full of dirt. Somehow got avoided getting run over by the bus like the scooter did. And we always say, we can't worry about things because you can walk out and get hit by a bus. And he got hit by a bus. But so there again is what's the moral of the story? The moral of the story is that it's the unexpected that kind of gets us, and luckily to this day he's fine, he's good, and I think he'll always remember that. I'll always remember it and realize that life is fleeting. So
it's so fleeting, right? It's like I don't know what moment in time changed my perspective on that, but I do feel like I think about that a lot. Like you try to, keep every day in perspective of, what's really important. That's the only way to do it, because otherwise you really can go adrift and you're going to miss things. God forbid. Yeah. Things end.
Yeah, absolutely. We want to take the time to laugh a lot, I think it's Jim Valvano. He said one time that a perfect day is a day where you laugh, you cry, and you think. So, I try to tell people, I hope you have more perfect days, because that means you're living life to the fullest and you're feeling life. You're feeling the emotions, which is good.
Yeah. Yeah. No, I mean, and by the way, you've really lived a great life, and you're living a great life. What it sounds like a eulogy.
Just like my.
I'm sorry. That does. I'm saying that as I'm about to grab this. I want to show this. You've lived a great life. He lived a great life, everyone. No, but I mean, you've really done some really important things. You've treated. I mean, listen. I think as any kind of healthcare professional, we affect so many people's lives, and especially people who walk every day, which is most of us.
Yeah.
You probably, people that come to me, that you've referred to me, who've had, obviously you've treated as patients, they literally characterize you as a godsend. So
Well, it's
it
funny.
really can be.
Yeah, I mean, I'm sure you know this too. Like, you don't realize like how many people really you touch, and sometimes you think it's goofy. Like, you get that piece of cake or muffin from the older lady who brings it in. It's like, oh, thank you.
Right.
Or
right,
like
right.
in my situation, people always want to bring me like foot related items, which is like, thank you. I have like in my office a stool that looks like a foot that someone made for me. I'm like, thank you. And ashtrays that are in the shape
foot
of
ashtray?
feet. I'm like, thank you. I really wanted that. But
What's the weirdest thing you've ever gotten from a patient?
yeah, it's probably that footstool. I think,
footstool.
yeah, with red toenails on it. Yeah.
Oh.
It's lovely. But yeah, that's definitely one of them. But I remember when I was sick, patients would write the nicest letters to me, and it, once again bringing you to emotion. You're like, why am I so important to you? I'm just taking care of your feet. And he goes, no, they would say like, you're important to us, and I'm sure you experience that all the time, knowing the kind of individual you are. Because you give it all, to them, and you realize that it's more than just taking care of a hand or a shoulder or an elbow. It's you're taking care of an individual, a person. Yeah.
Yeah, I mean, we're using our limbs to exist in the world and interact with it, and painlessly, ideally. And when you can't do that, that's when we get involved with people's lives.
Yeah.
And hopefully are able to have that impact that get them back to that. I wanted to mention this. This is Podiatry Today. You got to talk to me about this. This is a big deal. This is like GQ, the GQ of.
I don't know about that. I was really hoping
Podiatry.
to make People magazine one day, but Podiatry Today will have to do.
This will be your first. It's a stepping stone.
Yeah, that's funny. It was cool. I was asked to just write an article about optimizing outcomes for running injuries, and it's cool. It's like one of the things I'm passionate about. I live vicariously through my athletes. One of the things I have in my office, I have a wall of like Hall of Fame, and the Hall of Fame doesn't. I do have Olympians on my wall, but I also have people who have run their first 5K, and people who have lost, 30 pounds, and and they're so excited to share put their pictures up there.
I think that's really cool. Like, that's something that I think is so different than most people's offices. I've never seen it before, put it that way, and it really sort of enshrines the people who you've helped, but really you give them a platform for them to feel like they're important also in your life. And so that's what's really cool about it.
And like you're asking my story, right? Like, every one of those pictures, I look at it and they tell a story. I remember their story.
Yeah.
One way or the other, and it's it's kind of cool for me to look back on that and say, all right, this is fun. We've had a good run so far. Let's keep it going.
Yeah. You had asked me to get you a picture. I haven't done that yet. I don't know that I'm worthy to be on that wall, but maybe
you are. I mean, we got a video of you doing snowboarding, right afterwards. So that was kind of cool. Yeah.
That's true. Maybe I'll stick a picture of myself on a snowboard there, because that's actually what it's how I injured my Achilles. It was sort of an initial like insult, and then it never got better, right? The tendinosis, but that's what I got back to because of that. I really had a hard time doing that even. So that'll be the picture.
Yeah, I think the other part of it too is like, I live vicariously through some of them, some of their goals and things that they want to do. Like, I listened to your last podcast. You had David Caldwell, an ex-NFL player, and he was so good. I was listening to his story of how he went through all of his ups and downs, of trying to get there, and it was great, but he was at the elite level. And I think about myself as like, I was the last one picked in dodgeball, so I wasn't really there, but I can live vicariously through anybody who's reached the goal that they want to do. And that's what I always ask every one of my patients. The first thing when they come in, I say, what's your goal? And once we know their goal, we work from there, because, we don't worry just about like the tactics of how to get them better, but, you want to figure out strategies.
Yeah. Well, that's it. At the end of the day, you're not just trying to stand them back up on 2 feet. You're actually trying to get them back to whatever their goal is, whether it's playing tennis, whether it's running, whether it's, in my case, a lot of times it's, playing, playing baseball, whatever, batting, whatever it is. And, that's where the sort of the team approach comes in between trainers, coaches, certainly parents and therapists a lot of times.
Right.
Trying to be, we're all a team in terms of getting people back to that. And that's, by the way, across disciplines too, right? Because half the time they have two problems, a foot problem and a hand issue.
Oh, yeah.
Yeah,
and sometimes it goes beyond medical. I one of the places I send my patients to a lot is the running retailers. Like getting them into the hands of people who properly know how to fit them for shoes. As simple as that.
Right. Because that's such a good point. Like you think, oh, it's just a shoe store, but that is having either a positive or negative effect on their foot, which could then cause pain, which could cause pathology, which ends them in your office. So.
Yeah, like right now I'm seeing this. I think something that's keeping me in business right now is this new pickleball. Like everyone wants to play pickleball now, and they're getting hurt because they don't have the right gear, or they don't have the right fitness, or they don't have the right idea of flexibility and mobility. So something like as simple as a new game is keeping me busy.
The fastest growing sport in the country.
Yeah.
Right? So I'm trying to get my kids into pickleball. They love it, actually.
There you go. Yeah.
They love it. So.
I call it ping pong, bigger ping pong, it seems like.
Ping pong on a tennis court?
On a tennis court, yeah.
Yeah. So, listen, man, I really appreciate you coming by, sharing some of your stories.
Absolutely.
And we got to do this again. We'll dive even deeper into the Shockwave stuff. We definitely need to, and part of what I'm trying to do in my practice now, and this, we've been trying to, see where Shockwave will be, and it works. We know it works. It's just incorporating it into our practice for recovery enhancement, whether it's trying to avoid surgery, trying to avoid downtime, or as a recovery enhancement post-surgery. And I think there's a role for that. Even the EMTT especially, which you don't feel at all,
right?
Let alone, because the shockwaves you can feel a little bit, but the EMTT has a role. But I think we should probably come on and just have a deep dive podcast on that.
I love that. It's been like no joke. It's a game changer in my practice because we're keeping people going and they can keep training. They don't have to say, hey, you can't do anything.
Shut it down.
Shut it down. Yeah.
That has one of the biggest impacts on people's psyche and quality of life for a temporary period of time is putting them out of their sport, having them recover from a surgery. It can be a positive growth period, but no one likes it.
Yeah.
So if we can avoid that, then
I think there's been studies that show especially with athletes, if you take away their ability to train, sometimes it's like as close to a loss as a death. For some of them, they've seen it takes its toll, psychologically on them as well. So you can keep them moving, even if it's not exactly in their sport, but have them train somehow. It's great. So that's where I think things like these regenerative type of techniques can really be a way to. And it's I've changed because I was a surgeon. I am a surgeon, but I've kind of gotten away from that a little bit more now because. Maybe because of what I went through myself personally, and I really want to figure out ways other than surgery. And there's a lot of great surgeons out there that I can refer to, and I wanted to take the dive and figure out new tactics and new strategies.
I love that, and I think that your story actually, your personal story, kind of resonates with your career in that sense, right? Because you didn't end up having to have all that surgery.
No,
you ended up doing, obviously chemo and radiation is different, but you were able to get better without it. And obviously the path was the path, but it actually kind of now you've kind of evolved in that way. In a sense, you're giving people these really great opportunities to get better without the knife, without anything in any direct interventions under the skin, really, oftentimes. So it's really good. And we'll continue to, send my patients your way when needed.
Thank you. Thanks for the forum. It's been fun.
Thank you, my friend.
All right, man. All good. All right. Thanks.